Ever wondered what normal blood pressure looks like and why it matters? Let's dive in. Blood pressure is a measure of the force exerted by the blood against the walls of your arteries. It's like the water pressure in a garden hose. Too high and you risk damage, too low and the job doesn't get done. Now, what is considered normal can vary by age. For adults, a healthy blood pressure generally hovers around a systolic number, that's the top number, of less than 120, and a diastolic number, the bottom one, of less than 80. As we age, our vessels naturally stiffen, which can cause blood pressure to creep up. Therefore, the normal range for seniors might be slightly higher, but why does it matter? Well, maintaining a healthy blood pressure is like keeping your car's engine running smoothly. It's crucial for overall health. High blood pressure or hypertension can lead to a host of issues, including heart disease, stroke, kidney disease, and even vision loss. It's often called the silent killer because it typically has no symptoms until damage has already been done. On the flip side, low blood pressure or hypotension, while less common, can lead to dizziness, fainting, and in extreme cases, life-threatening shock. So you see, finding that sweet spot in the middle is essential. But don't worry, this isn't a doom and gloom scenario. There are plenty of steps you can take to ensure your blood pressure stays in the healthy range. Regular checkups, a balanced diet, exercise, and medication if necessary can all help maintain or even improve your blood pressure. And remember, knowledge is power. Understanding what constitutes normal blood pressure and why it's important is the first step towards safeguarding your health. Because when it comes to your well-being, you're the one in the driver's seat. Knowing what's normal can be your first step towards maintaining good health. Now, how does one develop high blood pressure? Let's break it down step by step, shall we? To begin with, high blood pressure, also known as hypertension, isn't something that just springs up overnight. It is a gradual process, often taking years to manifest. It's a bit like a pot of water coming to a boil. You might not notice the initial small bubbles, but before you know it, it's rolling. So, what are the factors that turn up the heat, leading to high blood pressure? There are several, but let's start with the unavoidable one: genetics. Yes, your genes play a significant role. If your parents or close relatives have high blood pressure, you're more likely to develop it. But don't get too discouraged. Genes are not the sole determinant. They merely stack the deck. How you play your cards is up to you. This brings us to lifestyle choices. Picture your life as a road. The path you choose to take can either lead you towards or away from hypertension. A road full of unhealthy eating, lack of physical activity, tobacco use, and excessive alcohol consumption is a one-way street to high blood pressure. Each of these choices puts strain on your heart and blood vessels, causing them to work harder and over time become less efficient. Then there's the matter of underlying health conditions. Some diseases and medications can raise your blood pressure. For instance, kidney disease can disrupt the natural balance of salts in your body, leading to hypertension. Certain medications like birth control pills or over-the-counter pain relievers can also cause your blood pressure to rise. Moving on, age is another factor. As we grow older, our blood vessels lose some of their elastic quality, which can increase blood pressure. This doesn't mean that young people are off the hook, though. High blood pressure can affect anyone, regardless of age. Lastly, stress plays a significant role. In response to stress, our body releases hormones that temporarily increase our blood pressure. While this is normal, frequently elevated blood pressure due to chronic stress can lead to long-term hypertension. So, there you have it. The journey towards high blood pressure is a complex interplay of genetics, lifestyle choices, underlying conditions, age, and stress. It's like a puzzle where each piece contributes to the bigger picture. But remember, understanding these factors is the first step towards prevention and control. High blood pressure, as you see, doesn't happen overnight. It's a gradual process influenced by various factors. Remember, knowledge is power. Knowing what contributes to the development of high blood pressure can empower you to make healthier choices and lead a better life. High blood pressure might seem harmless, but its effects can be devastating. Often brushed off as a minor health issue, high blood pressure, if left unchecked, can lead to serious health conditions. Let's delve into the potential health risks associated with high blood pressure. Firstly, it can lead to heart diseases. High blood pressure forces your heart to work harder than normal. Over time, this extra strain can damage your heart muscles, leading to heart attacks. It's like forcing a car to run at top speed for an extended period. Eventually, the engine will wear out. The second major risk is strokes. High blood pressure can cause blood vessels in your brain to clog or burst. This prevents blood flow to the brain, causing a stroke. It's akin to a traffic jam on a highway. If the path is blocked, cars can't move forward. The third risk is a bit more indirect but significant nonetheless. High blood pressure is often linked with diabetes. While the two conditions are separate, they often occur together. High blood pressure can make your body less able to use insulin effectively, leading to type 2 diabetes. Now, why are these conditions so common in India? The answer lies in a mix of genetic, environmental, and lifestyle factors. Indian diets are often high in salt and fats, which can raise blood pressure levels. Additionally, sedentary lifestyles and stress can further exacerbate the problem. The consequences of high blood pressure are not limited to physical health. It can also impact mental health, leading to issues like anxiety and depression. Furthermore, it can affect your quality of life, making everyday tasks more challenging. To sum up, high blood pressure isn't just a number on a screen, it's a serious health condition that can lead to heart attacks, strokes, diabetes, and more. It's a ticking time bomb, and the longer it goes unnoticed, the more damage it can do. So it's crucial to keep your blood pressure in check. Regular checkups, lifestyle changes, and medication can go a long way in managing high blood pressure. Remember, prevention is always better than cure. High blood pressure is a silent killer, silently wreaking havoc on your health. Don't let it sneak up on you. Stay vigilant, stay healthy. But fear not, high blood pressure can be prevented and managed effectively. We now delve into the prevention and management strategies recommended by the Centers for Disease Control and Prevention, or CDC. The good news is, a person can make significant strides towards normalcy, reducing their high blood pressure by as much as 58% through lifestyle changes, regular checkups, diagnostic tests, and timely medication. Let's start with lifestyle modifications. The CDC suggests maintaining a healthy weight, which can be measured using the body mass index, or BMI. If your BMI indicates that you're overweight, losing even a small amount of weight can significantly reduce high blood pressure. Next, we have diet. A heart-healthy diet is key in managing high blood pressure. The CDC recommends the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This diet emphasizes fruits, vegetables, whole grains, low-fat dairy products, and lean protein sources. It also suggests reducing sodium intake. Physical activity plays a crucial role too. The CDC recommends at least 2.5 hours of moderate intensity exercise every week. This could be brisk walking, cycling, or even gardening. Regular physical activity helps lower blood pressure and maintain a healthy weight. Now let's talk about regular checkups and diagnostic tests. Regular monitoring of blood pressure is vital in managing hypertension. A healthcare professional can provide you with a blood pressure reading, and regular checkups help you track your progress and make necessary adjustments to your lifestyle or medication. Timely medication is another important aspect of managing high blood pressure. If lifestyle changes aren't enough, your healthcare provider may prescribe medication to help lower your blood pressure. It's crucial to take these medications as directed, and not to stop taking them without discussing it with your healthcare provider. And lastly, let's not forget about the importance of limiting alcohol intake and quitting smoking. Both these habits can raise your blood pressure and cause damage to your heart. Remember, it's all about consistency. Small, daily changes can lead to big improvements over time. It's not just about preventing high blood pressure, but also about improving overall health and quality of life. As the CDC emphasizes, high blood pressure can be a silent killer, often showing no symptoms until it's too late. But with the right approach, it can be prevented and managed effectively. Prevention is better than cure, and it's never too late to start. So, let's start today. Let's commit to a healthier lifestyle, regular checkups, and timely medication if needed. Let's take control of our health, one step at a time. Because when it comes to our health, every step counts. Did you know that 58% of people can normalize their blood pressure with simple lifestyle changes? That's right, folks. A healthier lifestyle can significantly reduce your risk of high blood pressure, heart attacks, stroke, and even diabetes. Let's talk about some of these lifestyle changes. First and foremost, we have dietary control. Our diet plays a crucial role in managing our blood pressure. Consuming a balanced diet, rich in fruits, vegetables, lean proteins, whole grains, and limiting foods high in saturated fat can help maintain a healthy blood pressure. Reduced salt and spice intake is another significant change. The sodium in salt can cause your body to retain fluid, which increases blood pressure. And while spices add flavor to our food, excessive spice, especially the hot ones, can also raise your blood pressure. So, it's crucial to keep salt and spice levels in check. Minimizing fat in the diet, especially saturated and trans fats, is also essential. These fats raise your total cholesterol levels, leading to the buildup of plaques in your arteries, which can increase blood pressure. Instead, Opt for healthy fats like those found in avocados, nuts, and olive oil. Next, we have regular exercise. Physical activity strengthens the heart, allowing it to pump more blood with less effort, lowering your blood pressure. Aim for moderate intensity workouts like brisk walking or cycling for about 150 minutes a week, or vigorous intensity workouts like running for 75 minutes a week. Finally, let's not forget about stress management. Chronic stress can lead to high blood pressure. Therefore, it's essential to incorporate stress-reducing activities in your daily routine. This could be yoga, meditation, reading, or simply spending time with loved ones. Remember, these are not overnight solutions. Consistency is key here. It's about making a commitment to live a healthier life. And the good news is that you don't have to do it alone. Seek support from family and friends, or join a support group to keep you motivated. A few tweaks in your daily routine can make a world of difference to your blood pressure levels. So, why not start today? Your body will thank you for it. Managing high blood pressure isn't a one-time task. It requires regular monitoring and adherence to medication. This is a journey, a commitment to your health, and it's important to understand that this journey often involves regular checkups and follow-ups with your healthcare provider. Now, why are these regular doctor visits so crucial? Well, they allow your doctor to monitor your blood pressure levels and adjust your treatment plan as needed. They provide a platform for you to raise any concerns or discuss any side effects you may be experiencing from your medication. These visits are not just about taking readings, they are about understanding your body and how it's responding to the treatment. Follow-ups are equally important. They ensure that you're on the right track, and if not, they allow for necessary adjustments to be made. They are like the pit stops in a race, ensuring your vehicle, in this case your body, is functioning optimally. It's during these follow-ups that your healthcare provider can make changes to your medication or dosage, based on how your body is responding. Speaking of medication, it plays a pivotal role in managing high blood pressure. It's essential to take your prescribed medication on time, every day. It's not a choice, it's a necessity. Remember, these medications work best when they are in your system consistently. Skipping doses or not following the prescribed schedule can lead to fluctuations in your blood pressure levels, which can be detrimental to your health. It's also important to note that medications are not a substitute for a healthy lifestyle. They work best when paired with a balanced diet, regular exercise, and stress management techniques. The medication is part of the solution, not the entire solution. In conclusion, managing high blood pressure is a lifelong commitment. It involves regular doctor visits, diligent follow-ups, and unwavering adherence to medication. It's about creating a partnership with your healthcare provider and actively participating in your health journey. Remember, consistency is key when it comes to managing high blood pressure. So, let's quickly recap what we've learned about high blood pressure. High blood pressure, or hypertension, is a silent but potentially lethal condition. It's the result of pressure in your arteries being consistently too high. Its evolution can be gradual, often without noticeable symptoms until it's too late. It can lead to severe consequences like heart attacks, strokes, and even kidney disease. The good news? High blood pressure is preventable and manageable. The Centers for Disease Control and Prevention recommends a healthy lifestyle, which includes regular physical activity, a balanced diet low in salt, spices, and fats, and maintaining a healthy weight. Regular checkups and diagnostic tests, along with timely medication, are crucial. Remember, you can potentially normalize your condition by almost 60% with lifestyle changes and regular medical supervision. Your health is in your hands. Stay informed, stay healthy. Let's take charge of our health and keep high blood pressure at bay.